The epidemic. The stigma faced by overweight and obese Indigenous Australians. This presentation looks into the obesity epidemic in Australia and will specifically talk about the stigma faced by obese and overweight Indigenous Australian people. In this presentation, I will assess the positive ways to address the stigma that might impact the level of participation in targeted health interventions through the strength-based approach. Firstly, what do all these terms mean? Obese and overweight. To be considered overweight, an individual will have a body mass index of 25 to 29.9, and to be obese, a body mass index of 30 plus. The body mass index is measured in weight over height squared in meters. Stigma. Stigma refers to a feeling, commonly unwarranted, of strong disapproval towards something which is held by many people in society. The strength-based approach. This approach takes a realistic view on the situation people are in and harnesses and builds on the strengths they already have, as opposed to focusing solely on the problem itself. The weighty issue faced by Indigenous. I will now briefly outline the obesity issue encountered by Indigenous Australians. Historically, Indigenous Australians were hunters and gatherers and lived off the land. The sudden adaptation to Western lifestyle and diet has led to a high vulnerability to metabolic disorders. Across all ages and social groups, Indigenous Australians are more likely than non-Indigenous Australians to be overweight and obese. Despite the high prevalence of obesity amongst Indigenous Australians, highest in Australia in fact, there isn't as well-established understanding of the specific linking factors between obesity and Indigenous people that exist within the general population. The dimensions of stigma faced by the overweight and obese Indigenous Australian community. There are various dimensions to stigma associated with Indigenous Australians. Indigenous Australians are commonly and historically subject to racial stigma, which lead to discriminatory displacement and social disadvantage. These stigmatic views held by many have regularly been cited as having adverse effects on the health of Indigenous population. An example of this stigma is that Indigenous Australians are sometimes lazy, which more than 1/3 of the people beyond blue surveyed believed. Additionally, overweight and obese individuals face another degree of stigma. Based on Goffman's categories of stigma, obese individuals fit into two categories. Based on the visibility of fat on their body, one may be considered physically deviant. Secondly, people strongly associate obesity with poor self-control and willpower, and therefore obesity may be seen as a moral failing. These views on objective characteristics of obese Indigenous Australians lead to a social identity that is poorly valued. How to positively address the stigma. To constructively address the stigmatic views held towards obese individuals, the way in which various social representations of obesity evolve from culture, oppression, and power need to be understood. A health science approach to reducing stigma associated with obesity consists of honing in on the negative attitudes held towards obese people to understand how these attitudes become social stigma. This understanding is used to boost the engagement in health-promoting activities. Anti-stigma campaigns targeted at the public are very effective in changing the public's ideas and attitudes towards a specific stigmatized group. Increasing participation by addressing stigma, a strengths-based approach. The effects on participation of stigma. The stigma felt by overweight and obese individuals can influence their participation in health interventions or programs. People who feel they are stigmatized because they are obese are less likely to participate in healthy behaviors such as exercise and less inclined to engage in obesity-related public health messages. A great example of a public health program that steers clear of provoking stigmatic views and addressing weight management for Indigenous Australians is the Healthy Weight program. Various dimensions of the stigma obese individuals may fear when engaging with a public health initiative are considered in the delivery of this program. It is delivered by indigenous health workers through community-based workshops and is designed specifically for Indigenous Australians. This program targets and aims to reduce the weight and the waist and hip measurements of the participants and has had a very high success rate. In summary, this presentation explained that Indigenous Australians experience high rates of obesity and are subject to racial and social stigma. In order to promote good health and reduce the barriers stigma poses to participating in health promotion behaviours and interventions, the underlying social drivers of stigma need to be addressed from a positive, strength-based approach.